Our producer went somewhere. I don't know where he went. He'll be right back. I don't know.
Sure, he'll be
He's looking
back.
for something. I don't know what he's looking for.
Yeah.
Welcome back to Crazy Good Aging. I'm Dorothy Shore, and this is my co-host.
Valerie Freeman.
Today we're talking about the future of aesthetic medicine with someone I know personally and trust with my own care. Dr. Burns is a board-certified plastic surgeon here in Dallas with more than 2 decades of experience helping patients look and feel their best. He's known for combining surgical expertise with some of the most innovative technologies available today. Dr. Burns, welcome to Crazy Good Aging.
Thank you, Dorothy. It's so good to see you. I appreciate you having me.
Well, it's going to be so fun to talk about all the new stuff going on out there. I'm really excited about it because I feel like there's just so much new that I didn't know about, really, until I went to see you about something else. I don't remember what it was. I went to visit you, and then you're nurse, and you were talking about all this stuff. And I'm like, wow, there's a lot out there. So from your perspective, what's the biggest changes happening in plastic surgery right now?
You know, I love the introduction. And plastic surgery, if you're not evolving, you're just dead. It's a field that I think is on fire with innovation right now. We all are exposed to the world in different ways than we used to be. And I think your podcast is a classic example. I think back to, I'm 56. You're a little older than me, not a whole lot, but I think back to my grandmother who saw everything from the first airplane and rotary phone and all these advances in technology happen in her lifetime. And it's just accelerating so fast. And then in the field of medicine, we're seeing so many advances. We're all on camera these days. Social media is blown up. And we, as men and women in the industry, you're on camera so much that you see yourself, and it makes you understand how you see yourself inside feeling younger and on the outside looking older, and how do you marry those two things. And so in the field of aesthetic medicine, it's in my mind, what have we done to advance that? And it's all things. It's hard to just nail it down to one, but in my mind, I think of categories. I think first of all of non-surgical and surgical. And in the non-surgical realm, it's all the lasers and the technology and the red light and the peptides that we can now take, and our nutrition, our better understanding of diet and exercise and the role that these things play. So in the non-invasive world, there's new fillers constantly. There's new neuromodulators that relax muscles. There's light therapy, IPL, photofacial, lasers. And then outside of that box, there are things we can do surgically. And I see a lot of changes in the plastic surgery space. The changes that we're seeing, in facial aesthetics, people are doing surgery younger. That sounds crazy, but the surgery is now becoming, the recovery from the procedures is a lot easier than it used to be. We're operating in different ways than we used to. We understand that the face is now a 3-dimensional structure. We're not just pulling, for example, on a facelift. We're actually tightening the face. We're in the deep plane where the aging is really occurring. And we're also filling. So we're lifting and we're filling. We're treating the face as a 3-dimensional structure. In the body, things have changed so much with the GLP-1s, the Ozempic, the Mounjaro medications. Patients are losing drastic amounts of weight. And how do we deal with that? We can deal with them in a lot of different ways. Number one, surgery. Number two, we have tightening devices like Body Tight, which is radio frequency, or Renuvion, which is plasma, where we can tighten the skin that after weight loss. And breast augmentation, what used to be a week-long recovery is now done awake with a new technique called Preserve, which is minimally invasive. And we're using instrumentation to develop the implant pocket and specialized instrumentation to put the implant in the body, almost like injectable breast implants. We're repurposing fat. We can liposuction you, take that fat, purify the fat, strain the fat into micro and nano components, and highlight the face using fat grafting. So in the area of aesthetic medicine, it's just every area you can think of is full of innovation.
So that's how you get the most natural looking results.
Really is. And I think that's one of the things that I find so refreshing about today's aesthetic surgery market is people in the past have overdone plastic surgery, and we've learned from our mistakes. I think recently people have really stepped back from overfilling. 5, 10 years ago, everybody was avoiding surgery and filling the face so that we were distorting regular anatomy. Now, we're being much more careful with our choice of fillers. We're using biostimulators, which stimulate the body to produce elastin and collagen. And I think the results speak for themselves. I think people that I can just off the top of my head, I don't like to name celebrities. I don't think that's fair, but I can think of 5 or 10 recent examples of just beautiful work that's being done. And these people look really, really refreshed, but they look like themselves and not a cheap, stylized version of some person. So I'm very happy with the work that's being done in plastic surgery now. To your point, Dorothy, it's very focused on natural results, and it's okay to get older. It's just the way that we approach it is so different now.
Well, Dr. Burns, you talked about younger and younger people getting the surgery, and of course, I didn't get. I have had a facelift, and I didn't get it until I was in my late 60s, mainly because I was scared of the long recovery period. And of course, I was a little scared of what I'd look like afterwards. But you're saying younger and younger. What about older? I've been concerned, should I get, if I feel like I need to refresher as I get older, maybe in my 80s, is that too old? What are you seeing about ages?
It's really interesting. You've heard the expression, we all pick a decade. And I think the most common I hear is the 40s is the new 30s. So we've all sort of evolved, and we look at the pictures of our parents, and I think that people look younger today than they used to. And I think at the upper echelon, people seem to be living longer too. So to your point, how old is too old for plastic surgery? And that is a very, very interesting question. Facelifts are interesting because sometimes a secondary facelift is actually easier than the primary. The planes are already developed and things have already been done to a certain extent. So the procedure itself is not that daunting a second time around. And so from my perspective, I think for most careful, good board certified plastic surgeons, sometimes an 80-year-old in excellent health is an easier case than a 60-year-old in poor health. Some obese person that has heart disease, diabetes, and high blood pressure is going to be a much more challenging case than an 80-year-old who's walking 3 or 4 miles a day, playing with her grandkids, and is very healthy. So in my practice, I try to have some hard and fast rules, meaning if you're over 65, I like you to see your primary care physician and get what's called a medical clearance. Your primary care physician knows you well, knows what is involved in some of these procedures, and they can run the appropriate tests to make sure that your heart, lungs, and your body will be able to handle the stress of surgery. And I think to the next point that you made, I think we all remember our parents or grandparents having plastic surgery maybe in the past. And the joke was that you'd go somewhere for a month and kind of hide out during the healing process because it took so long to get over the bruising and the bleeding and the swelling. And today, that's just not the case. Give me a week and I think I could do better than a month, back in the 70s and 80s. And the reason for that is technique. It's also, we have much better medications now. One thing that comes to mind is we use one called tranexamic acid. It's an older drug, but one that's been applied to plastic surgery. It stabilizes the platelets. And so the platelets are responsible for clotting blood. So the amount of bruising I'm seeing in my facial aesthetic surgery is a fraction of what it used to be. We can give steroids to combat swelling. We are taking out sutures sooner. We're using red light therapy. We're using lasers to help fade bruising quickly. So what used to be a month of recovery is now a matter of days or weeks.
Well, I'm certainly glad to hear that the older we get, if we're in good shape, we can still take advantage of all the new advancements. I also go ahead.
I wanted to brag on Dorothy because she's one of my favorite patients. And one of the things I see in her and I just love is what is between your ears is more important than I think is what's going through your bloodstream, meaning that a patient that has a really positive attitude and a really positive outlook on life, it's amazing how powerful your mind is. And so, when I watched Dorothy come in and recover, her mind was so sharp and it was so ready to take on the challenge. And her attitude was so amazing that I think when you go into something not afraid and with a really positive attitude, and you're going to get this thing licked in no time at all, it happens. And I think that's one of the most important things. And sometimes with living life, you toughen up a little bit. And so some of my older patients do better than my younger patients who have a lot more anxiety and they're not in a really great headspace. And so where you are in your head is so important in that recovery process. So kudos to Dorothy and a lot of my older patients who have toughened up over the years and realized, hey, elective surgery, I got this.
Well, that's why Dorothy is my partner, because she loves to live life like I do. Well, I did want to mention what you said about more and more people are getting plastic surgery. I think everybody who looks at TV or on the internet saw Kris Jenner's facelift. The woman is 65 or maybe she's 70 now, I don't know. But it was all over the place and she looked fantastic. And so I'm sure that social media and seeing these women do these facelifts and looking fabulous has really caused some of the increase in the numbers of people looking into plastic surgery. What do you think about that?
Absolutely, that's a really landmark result, and I know the surgeon that did it, and he's very humble and he's very low key. And I just appreciate that so much because celebrities are people too, and I feel for them that they're in the spotlight. But she told about her facelift and her journey, and we all appreciate that so much because what a great job. I mean, the surgeon just did an absolute bang up job, and she looks amazing. I think another one that I appreciate a lot was Kylie Jenner. Kylie Jenner had breast augmentation surgery and she embraced it, and she came out on social media and described not only what she had done, but how it was done, and made a really positive impact for a lot of people. So I think that it's okay. And I think a lot of people that have plastic surgery, because of these women that are brave enough to share their experiences, Dorothy, you're one of them, it's empowering because it's like, hey, I feel great inside. I want to look great on the outside. I had this done, and here's my experience, and it's, I think, very helpful. And I don't think you're always going to get blowback on social media and people saying things about you, but I think for the most part, these cases have been very well received by the public, and we all admire these women for taking these steps to have some of these things done. But it takes some courage, and I for one appreciate it.
I'd like to shift the conversation a little bit because the one thing I really love about your practice and you is you're really kind of out there in terms of new, innovative things. And in getting your newsletter, I remember reading about this Preserve breast augmentation that is almost no downtime. Tell us a little bit about that.
Preserve is a technique. It's the doctor who invented it is Dr. Chacon, and breast augmentation came a long way in the 90s with a man named John Tebbets, and he was revolutionary in his approach to breast augmentation and really pioneered some of the techniques we use today. He's a Dallas man, and I know him, or I knew him well. He's deceased now, but Since Tebbett's sort of revolutionized breast augmentation, making it a very accessible procedure with minimal to very little downtime, there hasn't been much innovation in the space. And to my mind and to my way of thinking, we all have our own opinions, and I think there's some doctors out there that might not be as comfortable as I am with Preserve. But Preserve is a leap forward, in my opinion. It can be done under either local anesthetic or IV sedation, so it doesn't require general anesthesia. And we've done some market studies, and about probably 25% of the breast implant market are women that just don't want to have surgery. They like the idea of having a breast implant, but the idea of anesthesia is a little scary and a little daunting. So instead of sort of describing this thing as a surgical procedure with general anesthesia, we've taken a technique now where we've made it more accessible using IV sedation, and there's some practices doing it under just local anesthesia. But Preserve uses specialized instrumentation where we can create the space for the implant using a balloon dissector. So you go in, you add some fluid to the breast to create a space, and then you make a tunnel with an instrument called a channel dissector. And into the channel, you place a balloon, and the balloon you inflate to the size of your implant. So you create the space without cutting anything or having to look into the space. Once the space is created, then you can use a funnel, like if you're making a cake and you ice the cake with the funnel, the same kind of concept. The implants are now very squishy, and you can squirt them through the funnel into the space. And that's how the breast augmentation can be done in a very minimally invasive way. The recovery is absolutely fast. Most of my patients, could walk out of the operating room under their own power, no problem. And the next day they're back at work, and it's a procedure that we have made, I think, highly accessible. It's very new in the United States. I'm one of the early adapters of the procedure. You use a Motiva implant, which has been recently approved in the United States also. So their implants are specially designed not only for Preserve, but also to be placed above the muscle. And it's a revolutionary concept, in my opinion, in breast augmentation. And it's going to, in my opinion, expand the market to those women who are comfortable with the procedure, but maybe not surgery.
That just sounds amazing. And I feel like that is, that's really going to take off because it protects the breast tissue, the natural breast tissue, and it avoids cutting the muscle, and less pain, shorter recovery. I mean, what's not to like about that? So who is the ideal candidate?
Yeah, you seem like you might have done some reading, and I appreciate you bringing that up. The name Preserve comes from the concept of preservation. And so because we're not cutting anything in the breast, the supporting structures in the breast are left intact, and that they'll hold the implant, in my opinion, in a better position over time. So to your point, as you remember Preserve, also remember the concept of preservation, that we're not cutting your muscle. We're not going to be altering your anatomy in any significant way and nesting the implant in that breast tissue in a tight little space. And to your question, who is a good candidate for Preserve? And unfortunately, probably not everybody. So you have to be a first-time breast augmentation. If you have implants and need your implants replaced, you're not going to be a candidate for Preserve. So primary breast augmentation, it's usually designed for women that want smaller implants. Because these spaces are smaller, we're not going to do it for women that want an A to a double D cup size. Unfortunately, and I don't think that's a great approach to breast augmentation anyway. I think that what we're seeing now and the new generation of women coming up, they don't want huge breast implants anymore. They want something natural and something more size appropriate. And so Preserve fits that model. So women that want 1 to 2 cup size increases, smaller implants, primary breast augmentation are perfect candidates for Preserve.
And they do turn out to, the results are the same, the better.
I think the end results are, if you said which one of these is Preserve, I would have a hard time between, but I think on down the road, you're going to see the preservative implants probably age a little better. They won't be as susceptible to gravity as the old style.
Well, the breast augmentation is very exciting, but for me personally, I am excited about Renuvion because that is amazing to me. Now I know that that product has been used more for people who have lost a significant amount of weight, and so you use the Renuvion to help tighten up the skin, etc. But it's also now being used for women like myself who would just age, need tighter skin. And in fact, I had Renuvion done about 3 months ago, I guess. And I'm starting to see some good results from that. So tell us a little bit about that and how it works.
It's a fascinating device. Thanks for bringing it up, because I do think with the new weight loss drugs, we're going to be hearing a lot more of it. It formerly went by the name of J Plasma. They rebranded and renamed their product Renuvion. The science behind it is very interesting. It's a radio frequency and a plasma device, and so it delivers a very concentrated energy to the tissue. There's underneath the skin, there's a network of what we call fibroseptae, but there's some supporting structures that connect the skin to the fat under the skin. And when you superheat that skin in a very controlled fashion, that network of tissue, it causes a lot of contraction. And so with Renuvion, what I'm seeing versus some older technology, and I don't want to bash anybody, just talk the positives for Renuvion right now, but much better results than I've seen with older technology. Less thermal injury to surrounding structures, meaning that with the older stuff, I would sometimes get some thermal burns in the skin in some areas where that energy wasn't as tightly controlled. So uses for Renuvion, it works similar to liposuction. You make a small hole, you put in some fluid into the tissue, and then once the fluid has time to percolate, you go in with your energy device through a very small. So it's essentially a scarless operation. There's no big scars. And you pass this wand of energy back and forth enough times to deliver a certain concentration of energy per centimeters of the area that you're treating. And so once it's over with, it's really not very painful. And so patients that benefit are patients who may be a little older and have some looser skin, less elasticity of their skin. Obviously, the weight loss patients, post-pregnancy patients are very helped by Renuvion. And it goes very well with liposuction. So conceptually, liposuction, we're removing fat, the skin gets looser. But if we can figure out a way to combine liposuction with Renuvion, we're deflating, we're also tightening.
That's amazing. I'm really excited about it, and I think it's going to be something that's going to really, really take off, for sure.
I'm so excited about it, too. And to Dorothy's point, it's not an instant gratification tool, unfortunately. It does require some patience, and so you have to counsel your patients, hey, we're going to do Renuvion. You're not going to see a whole lot at first, but trust me, trust the process. And over the 6 months after the procedure, the skin gets tighter, tighter, tighter.
Sounds like magic to me.
It does. Well, I know that, Dorothy, you've had it 3 months ago, and I'm waiting to see how it works on you, and then then I'll be right there.
Yeah, I've got a whole group of women saying, "Okay, let me see the results."
So, a lot of us that are still, relatively thin, and we're aging, and our skin is aging. We want to tighten it up, but we're not ready for surgery. We don't want the surgery. We want something like Renuvion to help us. Is this something that you would consider for a lot of your patients that have the crinkly skin like we do?
I do. And I tell my patients this, that I think that there is going to be a gold standard. Obviously, for example, in the abdomen, if you have a lot of crepey skin, you're not going to get as tight as a tummy tuck. So, but like you said, some patients are not going to want to do the tummy tuck. That's a big operation. And so not everybody has to have the grand slam. You can get great results with Renuvion. And just because it's not as tight as a tummy tuck doesn't mean that they're not going to benefit tremendously from the procedure. So scarless operation, quick recovery. for busy women or women that just don't want surgery, it is an excellent option. Creating expectations in my business is very important. So, for example, if I tell you that I can get 80% of the result with Renuvion that I might get with the surgery, and I'm honest about you up front, you won't be upset at the end of the case when you didn't get the tummy tuck result, because we talked about it before and you understood. But I think the danger in plastic surgery is with marketing and all the things that we do and the pictures and the editing and all this sort of stuff. I think sometimes the truth is lost in there somewhere. So telling the patients the truth, I think, is the key.
Yeah, I do think that, and we talked about that before I got it done, be realistic about what you're going to get here. But, I do have to say, interestingly to me, was the abdomen area is already smooth. I mean, it's amazing. I mean, you would think I'd had a tummy tuck. It looks that good. The arms and legs, I think they're really good. If you don't look underneath, but I've got another 3 months, so who knows?
And I think that's the other thing, is just to make sure that the person you're offering whatever the technology to is the right candidate. So, and if your doctor doesn't say no occasionally, he's probably not a very good doctor.
So, what other non-surgical techniques are out there?
I think that in the filler world, where in the past we've done Juvederm, Restylane, there's a whole new subcategory of fillers, so to speak, that are called biostimulators. And so those go by Sculptra is one of them. There's an Ariessence that's a platelet-derived growth factor. PRP, platelet-rich plasma, PRF, platelet-rich fibrin. These are all things, instead of filling, we're trying to stimulate the collagen. Neocollagenesis is the concept, where you're stimulating the body to be younger, but it's not an instant gratification procedure. But I think it's much more natural and much more beautiful in the long run. So instead of puffing you up, we're going to renew the skin from underneath. I think that's been real revolutionary recently. Neuromodulators are here to stay. Those are the Botox, and there's always a new toxin on the market, but relaxing the muscles of facial expression has tremendous benefits in terms of fine lines and wrinkles, especially in the upper third of the face. And then lasers are constantly evolving. I think that we're treating many more things than we used to treat. Lasers, in the old way of thinking, were just sort of these sandblasters, and you'd get these ladies with these very white faces, line of demarcation at the thing, and then these aged necks. So the face looked burned, it looked white, and then the neck looked old. And now we're treating color, we're treating skin tone, texture, pore size, everything that goes into beautiful glowing skin. It's not just a lack of wrinkles. It is, youthful, vibrant skin. And so how do you do that? It's a combination of a lot of things and a lot of different wavelengths of lasers. So whereas we had a CO2 laser in the past, that was all we had. Now we have all different wavelengths and modalities, red light therapy, for example, and things we can do to sort of not do this all in one procedure, but in time. Maybe this month you have a salmon sperm and a microneedling. Maybe next quarter you get an IPL, a photofacial, and then maybe the next quarter you get like a 1064 facial rejuvenation. So I think the key is just really being focused on your particular case. And if you have a lot of red in your skin, focus on red. If you have a lot of brown or melasma, focus on that. And I think we're customizing things as we get better and better at lasers.
Yeah, I think that is great. I mean, it's a lot of little things anymore, not just one big thing, to keep your skin looking really good.
Well, you're probably, after people watching this podcast, they're probably going to come to you and say, just do me from head to toe.
Yes, absolutely. Well, this has been really fascinating. Don't you agree, Valerie?
Oh, this is wonderful.
Yes. And so I think, a lot of our viewers and listeners out there are going to be very interested in this, and hopefully they'll start doing their homework and finding out what all's going on out there. And we have lots, of course, people that are not in the Dallas area. So unfortunately, they can't come and see you, Dr. Burns. So they'll be out there locating a doctor who can. Anyway, we thank you so very, very much for being on our podcast.
Yes, thank you.
And those of you out there, we thank you for listening to Prime Women's Crazy Good Aging. If you found today's podcast informative, share it with a friend.
Yes.
And be sure to like us and subscribe. Also visit us at primewomen.com, where you can subscribe for free to our weekly newsletter. And join us next week for another
Crazy Good Aging.
I love it. Thank you, guys. Y'all are the sweetest.
Hey, thank you.
Thanks.
Thank you so much. Bye-bye.